SU23 Intro to Pharmacology, Chapter 11, Reproductive Drugs. Chapter 11 covers gynecologic and obstetric drugs, which are used to prevent pregnancy, treat infertility, stop preterm labor, induce labor, treat pain during labor and delivery, and treat postpartum bleeding, endometriosis, dysmenorrhea, sexually transmitted infections, and menopause, as well as male and female infertility. The female reproductive system. Drugs used to prevent pregnancy are known as contraceptives. There are many different types of contraceptives, including oral contraceptive pills, known as OCPs, transdermal patch contraceptive drugs, contraceptive subcutaneous implants, contraceptive vaginal rings, which are also known as a contraceptive insert, as well as intrauterine devices and vaginal contraceptive drugs. OCP means oral contraceptive pills, also known as birth control. The risk of OCPs include blood clots, stroke, and heart attack. These risks are increased for patients who are over 35 or patients who smoke. OCPs do not protect against sexually transmitted infections, including HIV. They contain OCPs that contain drospirenone, which is a progestin, have a higher risk of blood clots. In a 28-day pill pack, there are 7 placebo tablets, which are made from sugar and contain no active drug. Extended cycle contraceptive drugs are taken continuously for 3 months, which means a woman will only have 4 menstrual cycles per year. The oral contraceptive drugs Yaz, Estrostep, FE, and orthotricycline are approved for treating acne in addition to prevention of pregnancy. The drug Netizia is approved for the treatment of heavy menstrual bleeding. Drugs that decrease the effectiveness of oral contraceptives include anti-epileptic drugs, the natural supplement St. John's wort, and many anti-infective drugs, including drugs in the class of antibiotic, antivirals, and antifungals. There are 4 groups of oral contraceptive drugs that contain a combination of estrogen and progestins, and there are also progestin-only oral contraceptive drugs. Monophasic oral contraceptive drugs have one, mono means one, phase of treatment with a fixed dose of progestin drug and a fixed dose of estrogen drugs combined in one tablet for the length of the cycle. Monophasic oral contraceptive drugs in a 21-day pill pack contain 21 combined hormone tablets. Monophasic oral contraceptive drugs in a 28-day pill pack contain 21 combined hormone tablets and 7 inert sugar tablets. These contain no hormones, or they may contain supplemental iron, calcium, and or the vitamin B folate to complete the 28-day menstrual cycle. Orthonovum is norethindrone with ethinyl estradiol. How we tell that this is a monophasic, all tablets are all the same color with the exception of those 7-day hormone-free tablets. Yaz is drospirenone with ethinyl estradiol. Biphasic oral contraceptive drugs have 2 phases. Bi means 2. Phase 1 has a fixed dose of progestin, desogestrel, levonorgestrel, or norethindrone, and an estrogen drug, ethinyl estradiol, in each hormone tablet. Phase 2 has a decreased dose of estrogen-only drug in each, has a decreased dose of an estrogen-only drug in each hormone tablet. Seasonique is levonorgestrel with ethinyl estradiol. Here's Seasonique. Triphasic oral contraceptive drugs have 3 phases of hormone tablets in each pack. Each phase consists of a combined hormone dose of progestin, either desogestrel, levonorgestrel, or norethindrone, or norgestimate, and ethinyl estradiol in one tablet. The amount of the hormone and the length of each phase or the number of tablets in that phase, will vary from one phase to next. One of the examples is orthonovum 777. We've got 1, 2, 3 weeks, 777 of the variation. So here's just another image where it's showing the amount as it changes. So the amount of ethinyl estradiol stays the same, but the amount of the progestin, norgestimate, changes for each of the 7 days. Four-phasic oral contraceptive drugs are also referred to sometimes as quadriphasic. So they have 4 separate phases. So each tablet has a different amount throughout the cycle. And this is showing the drug showing different colors through each of the phases. Progestin-only contraceptive drugs are contraceptive drugs that contain either drospirenone or norethindrone. These are slightly less effective in preventing pregnancy than combination oral contraceptive drugs, particularly if the patient forgets to take even one tablet. Progestin-only contraceptive drugs contain no estrogens, so the risk of blood clots and other adverse effects due to estrogen drugs can be avoided. These contraceptive drugs are also useful for mothers who just gave birth and want to breastfeed, as the drug does not interfere with milk production. This drug is drospirenone, which is available by the brand name of Slined. Here we have the progestin-only levonorgestrel oral contraceptive that's taken orally to prevent pregnancy, but only after unprotected sexual intercourse has already occurred. These drugs are not indicated for routine contraception. So in addition to the levonorgestrel, the drug ulipristal is another option. So levonorgestrel is sold by the brand names Next Choice 1 Dose or Plan B 1 Step. These are sometimes called the morning after pill. I'm going to go back to that for just 1 second. Both of these drugs are also available over the counter. The levonorgestrel, Plan B 1 Step, or the Next Choice 1 Dose are available over the counter. Other drugs to prevent pregnancy can come as a subcutaneous, as a transdermal patch. This drug is norelagestrum, which is known by the brand name of Xulane. This patch, the patient puts a new patch on for a week. They do that 3 weeks in a row, and then they go 1 week without the patch in which to cycle. So the transdermal patch provides a continuous dose of progestin and estrogen. It's got norgestrone is your progestin, and ethinyl estradiol is your estrogen. It is important for the patient to take their old patch off when they put the new patch on, and to rotate their site. Generally, they're going to use their hips, buttocks area, or their upper arm. The worst side effect or the things that people might complain about is sensitivity to the adhesive on this. Next is a contraceptive subcutaneous implant. These drugs are progestin only. Etonogestrel is called Nexplanon. It's inserted. This has a little scalpel-like thing at the end, and it's going to cut a little hole, and then the rod is going to be inserted in the arm. It's showing you where. This will provide contraception for up to 3 years. It will require a doctor to surgically remove it just in office with some local anesthetic. Contraceptive vaginal rings are a pliable ring that gets inserted into the vagina. It's pinched and inserted, and it's left in place for 3 weeks, and then it's removed, and then it's cycled. Now, a note on these, the brand name is NuvaRing. It contains a combination of a progestin, etonogestrel, with ethinyl estradiol, the estrogen. And this is kept in the refrigerator until use because it will start to release the hormones as it comes into room and body temperature. So this is kept in the refrigerator until it's ready for use. And then we have intrauterine devices. These are known as IUDs. It's a long-acting but reversible contraception because they can be removed. There are hormonal IUDs, which are often referred to as IUCs, as an intrauterine contraceptive because they do contain a drug that releases a progestin hormone. These are effective for 3 to 6 years. IUDs that do not contain a hormone contraceptive are made of copper, and those are effective for up to 10 years. So here we have levonorgestrel, which is known as Kylena or Mirena. And here we see this one is wrapped in copper. And then vaginal contraceptive drugs that are inserted just prior to intercourse can include vaginal foams, films, gels, suppositories, and sponges. Most will contain the spermicide naloxone 9, which will kill the sperm. So the vaginal contraceptive sponge known as the Today sponge has naloxone 9 in it. And then we have Gynyl 2, which is a contraceptive gel that also contains naloxone 9. The agent that changes the pH of the vagina is a vaginal gel, Phexxi, and it's made of lactic acid, citric acid, and potassium tartrate or trititrate, and that's going to change the pH. So it's going to make an environment that's not good for fermentation. Next are drugs for female infertility. Infertility is the inability to become pregnant after trying for 1 year. These drugs will either stimulate production of eggs, preparing the endometrium to receive a fertilized egg, or by correcting a hormone imbalance. Gonadotropin-releasing hormone antagonist drugs are drugs that decrease gonadotropin-releasing hormone to prevent premature ovulation. Degarlix is Firmagon. This drug is given by a subcutaneous injection. Ovulation stimulating drugs are used for patients who fail to ovulate or have anovulation, or patients who have polycystic ovary syndrome. Use of these drugs will increase the chance of pregnancy with multiple pregnancies. The primary drug we use is clomiphene, which is also known by the brand name Clomid, and then urofultropin, which is Brevel. Clomiphene can be taken orally, where Brevel is injectable. There are also progesterone drugs for infertility. These drugs work by preparing the endometrium to receive a fertilized ova or a fertilized egg, part of an assisted reproductive technology procedure. These use progesterone, known by brand names Crinone, Endometrin, or Prometrium. And they have different routes of administration. So Prometrium is taken orally, where Endometrin and Crinone are inserts. Drugs used during pregnancy, we limit the number of drugs prescribed during the first trimester because there's an increased risk of birth defects. And we have exception for that when treating chronic diseases. Prenatal vitamins are usually given to help promote the development of the fetus. They often contain iron and folic acid. Due to morning sickness, nausea and vomiting during pregnancy can be very disruptive. There are only two drugs that are approved by the FDA for nausea and vomiting during pregnancy. And, well, actually it's one drug, two brand names. It's a combination of an antihistamine, doxylamine, and vitamin B6 pyridoxine. So the different names, diclegis is one of the more common ones, and so pyridoxine is vitamin B6. That's very helpful for nausea, and actually the tablet has a image of a pregnant woman on the tablet itself. And then the other brand name is Bongesta. So if you think good digestion kind of thing, so it helps with the nausea and vomiting associated with pregnancy. Drugs used during labor, delivery, and postpartum include drugs that are used to treat premature labor, drugs used to induce labor, drugs used to treat pain of labor and delivery, drugs that can cause an abortion, and drugs to stop postpartum bleeding. So the drugs used to treat preterm labor are used to relax the uterus, and these are known as tocolytic drugs. Drugs used to induce labor increase uterine contractions. This drug works the same and has the same name as a natural hormone, oxytocin, which is secreted by the pituitary gland. Oxytocin is available by the brand name Pitocin. We also have prostaglandins, which are a hormone secreted by the placenta and help to widen and thin the cervix. Dinoprostone is a gel that is applied to the cervix, which can cause dilation. Dinoprostone is known as Cervidil or Prostin E2 because it's prostaglandin E2 that's being activated, or Prepidil. It's prepping the cervix. I didn't put it on this slide, but one of the things about prostaglandins is they have the drug stem of prost. Drugs to treat the pain of labor and delivery. Most of these drugs are given subcutaneous, intramuscularly, or intravenously because the pain of labor can cause the woman to vomit. If a drug would be given by an oral route, it would not be effective. We also have things like epidurals, which is a type of anesthesia that can kind of numb the pain part. The pressure will still be there. Prostaglandins can dilate the cervix and stimulate the uterus to contract, which can be used to stop postpartum bleeding, but can also terminate a non-term pregnancy. This can include expelling a non-viable fetus or a fetus that has died in utero prior to full term. The drug is misoprostol, which we talked about for ulcers. It's a Cytotec is the brand name because it protects the cells in the stomach. But I also talked about don't take it pregnant because it can cause uterine contractions. Now, this drug can also sometimes be used to induce labor. Someone who's full term and they've not gone into labor and they're past their due date, they may use this drug to kind of induce labor. But we do see on this label, don't use if pregnant. Because it could cause an abortion or termination of a pregnancy. Now, drugs to treat postpartum bleeding. Normally after delivery of a baby and placenta, the uterine muscles contract strongly. This stops bleeding from the blood vessels at the site where the placenta separated from the wall of the uterus. Postpartum bleeding occurs when the uterine muscle fails to contract and allows continued bleeding from where the placenta was attached. These drugs will stimulate the uterine muscle to contract and stop postpartum bleeding. So we have methyl ergonovine, which is known as Methergin, or oxytocin, which is known as Pitocin. So we use Pitocin in inducing labor, and then we use it postpartum to stop the bleeding. And then drugs to treat postpartum depression. These are going to be antidepressant drugs, which we've talked about in a previous chapter. Drugs used to treat dysmenorrhea. Dysmenorrhea is a term that means painful menstrual cramps. It's caused by an increase in prostaglandins that can cause the uterus to contract painfully, and we use NSAIDs, both over-the-counter or prescription, to treat dysmenorrhea. Drugs used to treat endometriosis. Endometriosis is an overgrowth of the endometrium. So these are hormone drugs that suppress the menstrual cycle for several months, which allow the endometrial implants to shrink. Goserelin, leuprolide, and neferlin are the drug form of gonadotropin-releasing hormones. Continuous amounts of them for several months will suppress hormone secretion from the hypothalamus. Here I have Goserelin, which is known by the brand name of Zoladex. Next are drugs to treat menopause. Menopause is treated with hormone replacement therapy, known as HRT, which includes treatment with the hormone estradiol, but may include treatment with a combination of progestins and estrogens. Routes of administration for HRT include oral, transdermal patches, and skin gels. Using HRT helps to aid in decreasing the risk of osteoporosis and may help keep cholesterol levels lowered. These estrogen replacement drugs replace the decreased level of the hormone estradiol in postmenopausal women. This prevents the hot flashes and other symptoms of menopause from occurring. These are in the drug form of oral tablets, transdermal patches, and skin gels that relieve symptoms throughout the body. However, estrogens as a drug are associated with an increased risk of breast and endometrial cancer, blood clots, stroke, heart attack, and dementia. The most commonly used drug is a conjugated estrogen known by the brand name of Premarin. There's an interesting note in your textbook about where this name came from. Now, there are also topical forms of Premarin, vaginal gels, and then for estrogen, conjugated estrogen or estradiol. The topical forms, gels, creams, inserts, tablets, and rings, help relieve vaginal dryness and painful sexual intercourse, which is known as dyspareunia. Using selective estrogen receptor modulators, or SERMs, to treat menopause, they bind to certain estrogen receptors and stimulate them. These drugs are used to treat vaginal dryness and dyspareunia. They include the drug ospemifene, which is Osphena, and Uphin is the drug stem that's going to go with that. We talked about a SERM when we talked about osteoporosis. I used raloxifene, which is Avista. So this is another one. It's going to impact those estrogen receptors, but it has a different purpose. But they still end in that Uphin drug ending. And then we have combination hormone drugs to treat menopause. These have an estrogen, an estrogen receptor modulator, or a progesterone drug. So the more common one is going to be the drug known as Prempro, which is a combination of conjugated estrogens and medroxyprogesterone, which is known by the brand name, when it's a single drug, of Provera. So Prempro, it's Premarin plus Provera. Drugs used to treat vaginal infections. Vaginal infections can include bacterial vaginosis or vaginal yeast infections. The dose forms for vaginal infections can be oral formulations, or they can be a vaginal insert in the form of a cream, ointment, suppository, or vaginal tablet. Bacterial vaginosis, known as vaginitis, is treated with an antibiotic, and then if it's a yeast infection, it would be treated with an antifungal drug. So metronidazole, which is Metrogel vaginal, is an antibiotic or an anti-infective drug that could be used for vaginosis, whereas a vaginal yeast infection is going to be treated with an antifungal, or as the book refers to it, an anti-yeast medication, such as miconazole, which is known by brand names Monistat, Monistat 7, or Vagistat 3. The number after it says how many times you're going to use it. So this is Monistat 3. It's a 3-day application. Your antifungals have the drug stem of conazole. Not all antifungals, but the topical ones do. Now, the drugs that are used to treat STIs, so your book calls these STDs, we don't call them STDs anymore. They are not necessarily diseases. We use STI. They are an infection. My notes in assignment quizzes use the abbreviation STI, not STD. So just so that you're aware of that. So the drugs that we use to treat STIs include, well, what are we using it for? So we use antibiotics. Antibiotics are used to treat gonorrhea, syphilis, and chlamydia. Drugs to treat genital herpes. These are caused by herpes simplex virus 2, which is an infection in the genital area. It's going to be treated with an antiviral drug, such as valacyclovir, which is known by the brand name Valtrex. Genital warts are caused by human papillomavirus, which is a sexually transmitted infection, HPV. HPV can be prevented with vaccinations. And then trichomonas is caused by a protozoa, which is a single-cell organism, and is treated with metronidazole, which is not only antibiotic in property, but also antiprotozoal. HIV is a retrovirus and is treated with an antiretroviral drug. The male reproductive system, the drugs for male infertility and erectile dysfunction. Male infertility is treated with a hormone drug that supply hormones and stimulate the production of sperm. Testosterone, which is an androgen, which means it's a C3, control schedule 3, due to the Anabolic Steroid Act of 1990, enhancing testosterone. Testosterone can be administered through different routes of administration, including transdermal patch, such as Androderm, or as a gel, like Androgel, or as a topical solution, as we have here with the Axirin. Now, it is important to know if a patient is using a topical application that they need to use caution because it will absorb onto other people. So they need to be aware of female, small children, things like that. Erectile dysfunction is the inability of a male to achieve and maintain an erection during sexual intercourse. And we have two types of drugs that we use in addition to steroids, testosterone, for treating ED. The first is a phosphodiesterase 5 inhibitor, or a phosphodiesterase enzyme inhibitor, PDE5s. Inhibitors, these stop the enzyme phosphodiesterase 5, which breaks down cGMP, thus allowing a sustained blood flow to maintain an erection. All PDE5 inhibitors are taken orally. We've already seen tadalafil in the previous chapter, which is Cialis, but sildenafil, Viagra, was the first. It came out in 1998. They refer to it as the little blue pill. Then we have the tadalafil, which is Cialis. Your book talks about the price. This is 6 tablets of Cialis, costs $100. These are pretty expensive. And this is a 1-month supply, basically. Now, Cialis, as we learned in the previous chapter with the endocrine system, Cialis is indicated in treating BPH. So it can be used for BPH. It is important to note with a PDE5 inhibitor, it can cause an erection that lasts longer than 4 hours. That's known as priapism, and the patient must seek medical treatment if that occurs. Also, really important, can't drive this home enough, talked about in the cardiovascular system, there is a potentially lethal interaction with nitrates. Those are potent vasodilators. PDE5s, when they first were being developed, they were being developed for the cardiac system and their ability to cause vasodilation. Now, if you add them, the PDE5 with a nitrate, you get an additive effect, and it can cause a significant drop in blood pressure that can actually cause the heart to stop. So there is a potentially lethal interaction with PDE5 inhibitors and nitrates. And the drug stem for your PDE5 inhibitors is a fill. So sildenafil and tadalafil. We can also use prostaglandins for treating erectile dysfunction. These work by relaxing smooth muscles of the arteries in the penis, which allows an increase in blood flow and allows for the engorgement. So we have alprostadil, which is known by the brand names Caverject. This is injectable. It's injected into the side of the penis. Or Edex, and it's kind of, when I see this, I'm thinking you've got ED, you want to get rid of it. It's no longer ED, so it's your EDX, your Edex. Both of these are injectables, and then Muse is actually a pellet that gets inserted into the urethra. So it comes with this small little device. The pellet is loaded, and then it's kind of like a little bellow. It pushes it up into the urethra and can be absorbed through the penis. And these are prostaglandins, so they have that drug stem of alprostadil. Usually with prostaglandins, the prost is in the middle of the generic name. Okay, and more questions.